Hi, I'm Gianna.
Hi, my name is Jackie.
And I'm Jay. Janteice is my name. We are students at Nebraska Methodist College, and today we'll be exploring two distinct yet significant health conditions, herpes and malaria. Though they are caused by different pathogens, both diseases have a considerable impact on the world and individuals. In this presentation, we'll delve into a basic pathophysiology, disease history, as well as present and future implications for both conditions. And then we'll talk about the nursing implications related to each. By the end of this session, we hope to increase awareness about the importance of timely diagnosis, effective treatment, and prevention efforts, while also addressing some of the misconceptions surrounding these diseases. So I'll start off. We'll start by looking at herpes and its impact on health. In this first slide, we're talking about herpes defined. Herpes is an infection that's caused by a group of viruses known as herpes viruses. These viruses can cause a variety of symptoms depending on the type of herpes virus that's involved. There are 8 types of herpes viruses that infect humans, the most common being HSV1 and HSV2. The other types are also shown on this table, but they include the varicella-zoster virus, Epstein-Barr virus, cytomegalovirus, human herpes virus 6, human herpes virus 7, as well as human herpes virus 8. While the herpes viruses are genetically and structurally alike, they're responsible for a wide range of mostly distinct clinical conditions. The biggest exception to this is the Epstein-Barr virus and HHV8, as they both can cause certain cancers. Examples of the conditions can be seen in the table that's provided. We're going to move on to the herpes history. On the historical side of things, the article by Follusakin in 2025 explains that herpes viruses have a long and complex history with evidence of their presence in humans dating back thousands of years. The term herpes is derived from the Greek word meaning to creep or crawl, reflecting the spreading nature of the lesions associated with these infections. There is evidence that shows in ancient times that the symptoms of herpes were recognized, but the understanding of the disease was limited. In the 16th century, William Shakespeare referenced herpes in his play Romeo and Juliet with his mentioning of blisters or ladies' lips, indicating an awareness of the disease even during that period. The identification of herpes as a viral infection did not occur until the 1940s, marking a significant advancement in medical understanding. As you look at the table, it gives a little bit more information as far as some of the spread and the things of that sort. One of the mentions is in the 1960s, the development of the antiviral drugs began, and this provided new treatment options for herpes infections. These early antiviral agents laid the groundwork for more effective therapies in subsequent decades. When we're talking about the populations that are affected by herpes, if we break it down by race, World Health Organization data shows that HSV2 is most prevalent among non-Hispanic Black individuals, followed by non-Hispanic whites, and then Mexican Americans in third. Women are more likely to test positive for HSV2 than men, and HSV1 is commonly found in children and is typically spread through saliva, while HSV2 is more common after the start of sexual activity and during delivery. Older age and a higher number of sexual partners increases the likelihood of having HSV2 antibodies.
Okay, talking about herpes past. Um, I would like to just point out that this little booger is got lots of miles on him. Over the centuries, HSV has traveled hundreds and thousands of miles across oceans and continents, and leaving very few areas affected, as Jay pointed out. Um, Knowledge-wise, unfortunately, there was very little understanding of this virus, its contagious abilities. No one understood the true power of germs or how they spread and or even how to protect themselves. So this germ with its uncanny ability to spread just was had the ability to wipe out thousands of lives. Um, Herpes also is extremely resilient, and it's proven that by invading DNA and maintaining multiple modes of transportation. which has made it very hard for us to find a cure. This virus in the past, present, and future is going to continue to pose a threat. Thank you, Jay. I got this quote over here from a very intelligent fellow named Vijay Kumar Malisu. I'm sorry if I butchered that. But he wrote in a medical life science articles that studies completed in 2020 showed 26 million individuals ages 15 to 49 acquired new HSV2 infections, with 520 million living with HSV2 and 188 million experiencing HSV2. That is huge numbers. 17 million acquired new genital HSV1 infections, while 376 million living with genital HSV1 and 17 million experiencing HSV1. I just wanted to point out that 2020 was not that long ago, and we're still having millions and millions of people affected by this virus. The spread of this virus is still very rampant throughout all areas of the world, which shows it's a continued threat to people and shows no signs of slowing down. Diversity. The numbers of cases are not equal throughout the globe. Areas of poverty and less advanced medical care have higher numbers than areas that, have higher numbers than people are affected. And herpes future. Prevention. Number one, primary vaccines. They reduce the severity of symptoms. They excel the healing process of lesions and reduce the spreading potential. Everyone get vaccinated. Is an effective vaccine has been proven hard to produce as it requires DNA manipulation, as I previously touched on. While a vaccine is underway, none have been proven effective enough for FDA standards. Education. Primary interventions are essential to the decrease of disease spread. Alongside vaccines comes education, and education about the disease, its effect on the body, and the transmission. While nurses, we are so good at educating all of our patients. Sorry, we have to understand, that each person needs different types of education. Okay, go ahead. Thank you.
Herpes simplex virus 1 and herpes simplex virus 2, also known as HSV1 and HSV2, share many similar and identical signs and symptoms in an infected person. The biggest difference between HSV1 and HSV2 is the areas that they impact on the body. HSV1 tends to impact the mouth and cause oral lesions, blister-like cold sores, swollen lymph nodes, fever, or sore throats. HSV2 tends to impact the genital areas and causes painful lesions or blisters on the genital area, itching and tingling, flu-like symptoms, and can cause pain during urination. Some of the treatments for these are antivirals, but the virus is something that can't be cured, so the medications are used to just assist with alleviation of the side effects. The virus will remain inside of a person's body for the rest of their lives, but it will not always be active and causing symptoms unless triggered by things like stress or hormonal changes. The main antivirals used to treat this condition are acyclovir, valacyclovir, and famciclovir. Since flare-ups can be quite painful with the blisters and lesions, over-the-counter painkillers like aspirin, acetaminophen, ibuprofen are helpful. The use of an ice pack can also help with pain, and also using like Vaseline can help alleviate some of the itchiness that comes with herpes. And then some things that we can do to prevent herpes: avoid sharing items that saliva has touched, avoid sexual contact during an outbreak, or use barrier forms of protection.
Excuse me. Now we're going to move on to malaria. According to the World Health Organization, malaria is a potentially life-threatening disease that's caused by the Plasmodium parasites. There are 4 known types of malaria. They are P. falciparum, which is the most severe, P. vivax, P. malariae, and P. ovale. Malaria is usually transmitted through the bites of infected Anopheles mosquitoes, which is the female mosquito. The parasite travels from the bloodstream to the liver, and then it mutates and matures, and then it infects red blood cells that causes symptoms like fever, chills, or like a flu-like illness. Without prompt treatment, malaria can lead to severe complications or even death. As far as the history goes, the World Health Organization provided a fact sheet that discusses how it has a long history with evidence of disease dating back to ancient civilizations. Clay tables from Mesopotamia mention deadly periodic fevers indicative of malaria. Malaria antigens have been detected in Egyptian remains dating from 3200 and 1304 BC. And then it also mentions in the 19th century the discovery of the Plasmodium parasite by Sir Ronald Ross in 1897 established the parasitic cause of malaria. Up until this point, it wasn't really known what was causing the symptoms and the things that people were experiencing. This breakthrough led to the development of anti-malarial treatments and preventative measures. In the center of the slide, you can see that I mentioned the Global Technical Strategy for Malaria 2016 to 2030. This was adopted by the World Health Assembly in May of 2015. It provides a comprehensive framework to guide countries in their efforts to accelerate progress towards malaria elimination. The strategy sets the target of reducing global malaria incidence and mortality rates by at least 90% by 2030. A link to the document can be found in the slide. It's like 300 pages long, so we weren't going to open that. When we're talking about the populations that are affected, the World Health Organization data shows that there's 263 million malaria cases globally in 2023, which is an increase from the 252 million that were in 2022. Malaria-related deaths were estimated to be 597,000, which was slightly down from the 600,000 in 2022. The WHO African region continues to bear the largest burden of malaria globally. They are the hardest hit, accounting for 94% of cases and 95% of deaths worldwide, with children under 5 making up 76% of those fatalities. The 4 countries mentioned in the slide, Nigeria, the Democratic Republic of the Congo, Niger, and Tanzania, accounted for over half of the deaths. Infants and young children, pregnant women, travelers, and individuals with HIV and AIDS are at higher risk of severe infection.
Thank you. Malaria past. Growing with humans. With the entangled past of malaria and the human species, it has affected our evolution and as we strive to survive. According to Stocked and Meeson's article, Malaria Past, Present, and Future, the adaptations made in humans are believed to have resulted in diseases such as sickle cell anemia, thalassemia, and GSPD efficiency. Malaria is more prevalent in the tropical areas, as Jay mentioned. However, still has the ability to travel, and people who have active malaria produce only a small immunity, which sadly does not last very long, and it does not prevent any type of future infections.
So malaria is still a global public health threat, and I think Jay mentioned, but just in 2023, there is around 600,000 malaria-related deaths that occurred across 83 different countries. For let's see, number of malaria cases actually jumped around 1 million from 2022 to 2023, for a total of 265 people that were infected in 2023 internationally. Although there are many different Plasmodium parasites known to carry malaria and infect humans, P. falciparum and P. vivax are currently the two most common parasites. P. falciparum is predominantly found in the continent of Africa and is considered to be the most deadly. P. vivax is the most dominant malaria parasite in countries outside of Africa. Just in the past year, the United States has also started seeing their own cases of malaria arising from infected humans that had not previously been out of the country. This indicates that mosquitoes are carrying the parasites, and researchers have concluded that warmer, less mild winters in states that typically freeze and kill off the mosquitoes are contributing significantly to this.
And for future, vaccine. The first vaccine for malaria was started in 2019 and has been given to children in Kenya, Africa, and Malawi. I got that from the World Health Organization. The vaccine is an RTSS, first generation vaccine. And I thought it was interesting that they are using similar testing strategies and components to current vaccines, such as the flu and the COVID vaccine. Another way to prevent the spread of malaria for our future is via vectors. These areas use nets that have been infused with pyrethroid and or chlorophenapure. And those are being used inside homes or areas where people are residing for longer areas of time, and they have been shown extremely effective. The indoor residual spraying is also used, and now they're beginning to have people use ATSBs, which are attractive targeted sugar baits, and they're basically like a paper fly trap hung outside people's doors to attract all of the mosquitoes and such so they don't even try to come into the homes. For under medicine, recently approved in Australia is a medicine called tafenoquine for the prevention of the P. vivax malaria for children ages 2 to 15. As single doses, tafenoquine is expected to support patient adherence and treatment. This reduces how many times people have to seek medical attention. The current medicine treatment right now, you have to get multiple doses over 6 to 9 months. So that is beneficial. A 7 to 14 day course also of the Giana lumefantrin. And I also got that from the World Health Organization.
All right. So some of the signs and symptoms of malaria can appear as flu-like because they usually involve some sort of fever or chills, headache, muscle or joint aches, anemia in severe cases, and nausea or vomiting. Anemia can occur in the patients infected with malaria because of the destruction of red blood cells that occur in the body. Malaria is typically treated with what is called an artemisinin-based combination therapy, where multiple drugs are combined, and one drug will be like a long-term one, like mifloquine, and then the other drug is a short-acting one. They use these combinations to treat malaria because this significantly reduces the likelihood that malaria would reoccur in the patient because the single-celled malaria parasite is killed off. The best way to determine if someone is infected with malaria is through blood testing because the symptoms are nearly identical to many other diseases. It is also important that you let your provider know if you have recently traveled to another country and returned to the United States because most malaria parasites are contracted in other countries. It is very important that the patients get treated for malaria quickly after they start not feeling well because it can lead to rapid deterioration and even death if not treated. Some ways that people can avoid contracting malaria are by getting the malaria vaccine, which was mentioned, using mosquito repellent that contains DEET, using bed nets or window screens, using insecticides, wearing clothing that covers most of the skin, like long shirts, long sleeve shirts or long pants. And then also, like Gianna mentioned, the vectors.
Okay, so while doing this project, one thing I noted as the biggest takeaway is that we're never really going to escape diseases, especially like malaria and herpes. So I think it's important that we all work together to find solutions for prevention, treatment, um, and to just try to eradicate these diseases that are taking so many lives. We should fight the biases. There's unfortunately stigmas with all diseases. And as nurses, it's important for us to treat everybody the same. Um, and I think we should educate everybody to follow us in that lead.
I definitely would have to agree with Gianna. I think that malaria and herpes are definitely something that's kind of overlooked in the United States just because like it's not a prevalent, I mean, it's a prevalent issue, but it's not like tons of people are having these diseases like in other countries. Um, I think that when we become complacent though and are uninformed about these diseases is when they spread and like as we saw in the COVID-19 pandemic, playing catch up on prevention is basically impossible. So just something to keep in mind.
For me, pretty much what I learned is that learning about infectious diseases offers valuable insights into how pathogens like herpes and malaria spread, impact health, and can be prevented or treated. Both of these diseases are treatable and preventable, but the biggest thing I learned is it takes everyone's due diligence to make eradication possible. We got to do it together. And here's our references to look back on. And